All people are born with hemorrhoidal veins, and more than 75% of the population will develop hemorrhoids at some time in their lives. Over 10 million patients seek help from a physician each year because of
An increasing number of physicians are now screening their patients with flexible sigmoidoscopy. Side effects, especially discomfort during and after treatment, were considerably less with IRC. Relief of symptoms can be offered, and the evidence is persuasive that development of grade 3 hemorrhoids can be prevented. We advocate treatment of symptomatic internal hemorrhoids with the infrared photocoagulator to alleviate symptoms and to assist in preventing early grade hemorrhoids from developing into a more serious problem.
To understand hemorrhoid treatment by infrared coagulation, it is useful to review the anatomy and the manner in which the IRC affects tissue. The dentate or pectinate line is the junction of skin and mucosa located a few centimeters into the anus. It is the site of the anal papillae, which are white. Hence, the ancient anatomists termed it the dentate tooth line. The anoderm below the dentate receives sensory intervision and is highly sensitive to pain. The mucosa in the rectum above the dentate has no sensory perception. This area feels pressure and heat, but usually not as sharp pain. It is here above the dentate line that treatment of internal hemorrhoids was usually possible without anesthesia. Internal hemorrhoids originate above the dentate line. External hemorrhoids that occur below this level may thrombose and present as painful perianal masses. Hemorrhoids are further defined in terms of grades. Grade 1 hemorrhoids are small and do not prolapse. Grade 2s may prolapse during straining but spontaneously retract. Grade 3 hemorrhoids retract only upon manual reduction. Grade 4 indicates a state of permanent prolapse which cannot be reduced. All grades can bleed. The IRC is recommended for first, second, and minor third-degree hemorrhoids, all of which should respond well to treatment. Shrinkage, recession, and elimination of bleeding are achieved through controlled coagulation and mucosal fixation. Let us examine the infrared coagulator and how it works. The IRC is plugged into a standard 110-volt outlet. The patient is never exposed to electrical current and does not have to be. Guide is applied with light mechanical pressure. It compresses the mucosa and veins against the underlying sphincter muscle. Infrared energy coagulates and seals this venous plexus and tethers the mucosal to the muscularis, thereby reducing blood flow to the hemorrhoid. This causes the hemorrhoid to shrink and prevents prolapse. Hemorrhoids are usually found in 3 of the 4 quadrants. Multiple hemorrhoids can be treated during each visit. The physician requires treatment with the IRC does not involve application to the hemorrhoid itself, but to the bulging mucosal above the hemorrhoid. Subsequent exposures are then made, leaving a gap of 2 to 3 millimeters between treatment areas. One of the distinct advantages of infrared coagulation is the safety and predictability of the results. At 1.5 seconds exposure time, the depth of coagulation time is only 1